Hi there guys, thanks for joining us again for Radfield Home Care's Coronavirus Focus. Today I am joined by our franchisor and co-founder Hannah MacKechnie, and we're going to have a discussion today about how coronavirus pandemic has impacted the recruitment and retention of our care professionals. Naturally, throughout recent weeks and recent months, the care professionals, frontline key workers have been doing a fantastic job, and our really valued care professional team are absolutely part and parcel of that. So, Hannah, taking us back to the beginning of the pandemic, back in late Feb, early March time, are you able to walk us through what some of the worries were at the start of the pandemic arising?
Yeah, sure, absolutely. Well, obviously unprecedented times that we've been living through over the last few months. So I think going back to, when this was all starting to, we're starting to become aware of the coronavirus and, that we were heading into really challenging times. I suppose probably one of our initial thoughts were around the sustainability of our service and our workforce. School closures, that was one thing that we were very worried about, because obviously a lot of our workforce are, have got young children or children of school age. So, the idea that the schools are going to close, that was going to potentially have a really big knock-on effect. So we have to say we were very relieved when, as things developed and we found out that schools were going to be kept open for key worker children. That allowed us to then obviously, be able to carry on and make sure that our workforce was kept largely intact. So that was great relief, I have to say. So we were very, very relieved at that decision. And that has enabled us really to carry on, almost business as usual, I would say, in terms of our workforce. Okay,
that's really positive. What about, have you had any challenges with carers, understandably maybe being worried about working in the care field during the pandemic for obvious reasons, really?
Yeah, absolutely. And I think probably every sector, every frontline key worker, any business operating in that space will have a certain percentage of their workforce who are concerned, as most of the general public are as well, around working closely with people potentially contagious and contracting the infection. However, yes, we have obviously had to look after our workforce, and there will have been a certain percentage of that workforce who have had to look after themselves, protect themselves due to existing health conditions. So, a lot of those people, we've obviously had to move them out of the workforce and protect them, and then recruit as well to be able to ensure that we've got sufficient numbers of people in the sector to, in our business to carry on.
Yeah. And obviously you mentioned recruitment, which is obviously a really critical thing for any business at any time, but particularly during these times. I imagine is it being more challenging than normal?
Well, recruitment in the care sector has always been, over the last, many years, it's become more and more challenging. However, interestingly, and something we didn't really predict, is that actually recruitment has become significantly easier for us over the last few months. I think initially because of the, lots of redundancies happening, and unfortunately a lot of companies took the decision to make people redundant before the furloughing scheme was announced. So a lot of people experienced those early redundancies, and then obviously, unlikely to be able to find another job in their sector at this point, especially people working in hospitality and industries like that. We experienced a huge upsurge at that point in people wanting to come and work in the care sector. So actually, we were very, very busy with recruitment at that point.
Okay, so that's really positive to hear. So it's not been as much an obstacle as it maybe has been at other times.
No, we've definitely seen a significant uptake at that early stage. As the furloughing scheme was introduced and the public got used to that, that rate has fallen slightly. However, we're still seeing a lot more interest in people wanting to work in the sector, and I think that's partly due to how much the sector's in the news at the moment as well. It's been, it really has shone a light, especially on the home care sector. Care homes, people are always aware of care homes, residential homes, etc. But the awareness of home care amongst the general population has been fairly low. So actually this has shone a real light on that. And then people wanting to get involved and actively wanting to play their part. So we've had lots of people from other sectors who've chosen to come and work in the care sector, which has been so positive. It's been brilliant.
Yeah, David, I think that's one of the positives to come from the pandemic in general, isn't it? There's been a focus on care and giving and community a lot more. So I can understand definitely how that's impacted on recruitment positively. What about moving forward, do you think? Obviously there's a lot of talk and a lot of predictions that there is maybe difficult economic times on the cards in the coming months. How do you think that may play its part in recruitment over coming weeks and months?
Well, I think obviously the furloughing scheme is going to be ending, and with that and the expectations on companies increasing their contribution towards staff who are furloughed, it's going to put more pressure on those companies, especially if they can't see a way forward to actually regaining their business levels, to be able to sustain those staff. So unfortunately we're looking at probably a period where other sectors are having to make redundancies in volume over the coming weeks and months. So actually what we are predicting is seeing a continued trend, if not an increase, in people wanting to come and work in the care sector over the coming months and possibly even longer.
Okay. And so is that something that you experienced when you first launched Radfield? Because obviously you launched Radfield in the midst of the previous financial difficulties in 2008. Similar sort of trends happen then, did you find? Or?
I would say similar trends, only on a much lesser scale back then, because we weren't seeing such impact on specific sectors back in 2008. It was more of a sort of affecting every sector really, whereas this pandemic has really hit hard on specific sectors such as hospitality. So I think what we're seeing now is probably, you're seeing certain sectors that are really contracting, and those, people who are going to be made redundant or have already been made redundant need to look into other sectors. So I think that's the big difference here. You're having impact on certain sectors, which mean that people are having to move sectors and therefore considering the care sector.
Yeah, absolutely. And fingers crossed that will be a decision that they find really valuable and they stay in the sector.
Yeah, that would be brilliant. We've already got some lovely stories in our network of people who've come across into the care sector for the first time, either through redundancy or because they actually chose to, wanting to make that move. Maybe they've been considering it for a while, but actually this has been the trigger point for them to say, yep, I'm going to give it a go. And it's been lovely hearing some of those positive stories about how rewarding they're finding it, and that's just brilliant to hear.
Brilliant, fantastic. So obviously, when you talk about coronavirus, something that's almost goes hand in hand with it is obviously that furloughing scheme.
Yeah.
Is that something that many of our franchise partners have had to utilise?
I would say, generally speaking, no. It's because our sector, our business has been able to carry on trading, and actually we've been busier than ever really over the last few months. So actually, not really. The only time we've used it really is for those care staff who haven't been able to continue in their role due to having to protect themselves. So with pre-existing health conditions, those are the staff that we've been able to use that scheme for, to help them. But as a business, no, we haven't really had to use that because obviously, things have been really
growth
positive.
Has been strong enough.
Yeah, absolutely. Yeah.
Brilliant. Okay, brilliant. So it sounds like, in summary, recruitment has been eased in some respects, which has really helped support that ongoing growth that we've experienced as an organisation, as multiple locations across the country as well, which is obviously works hand in hand.
Yeah, absolutely. Yeah.
Brilliant, fantastic, excellent. Thank you very much, Hannah. So,
you're welcome.
Hopefully that was a real useful insight for you guys about how recruitment has really been impacted during the coronavirus pandemic. It might have been a surprise to hear that it hasn't been quite as difficult as maybe initially some media may have portrayed it may become. So join us again next week when we will be having a really interesting discussion around the services and how our services to our clients have been impacted by the coronavirus pandemic. As always though, if you have any thoughts you'd like to share with us or questions you would like to pose to us, you can email them to us at franchise@radfieldhomecare.co.uk and we will discuss those in the coming weeks ahead. So I look forward to speaking to you again next Friday at 1 o'clock for our discussion about how coronavirus has impacted the clients and services we provide. Thanks very much.